Hey everyone, and welcome to this explainer. If you're a focused learner looking to get straight to the facts, you are absolutely in the right place. Today, we're tackling something that affects literally millions of people but is so wildly misunderstood: managing and relieving sciatica using expert medical guidelines. We're going to break down the actual mechanics of why you're hurting, and more importantly, walk through a clear, step-by-step visual guide to actively managing it. So get ready to take some mental notes.
If you've ever experienced sciatica, you know all about that radiating, burning reality. It's definitely not just a dull ache, right? It's like this electric shock that completely hijacks your lower body. But what if the solution isn't just resting in bed or aggressively yanking on your hamstrings? What if you could actually floss that pain away? Okay, let's dive into this, because the whole concept of nerve flossing might just completely change how you approach your recovery.
Here's our quick roadmap for today. First, we'll get a real understanding of what sciatica pain actually is. Then, we'll unpack the science behind nerve flossing. After that, we're jumping right into the practical stuff with nerve glide exercises and essential static stretches. And finally, we'll go over the most common mistakes you need to avoid so you don't undo all your hard work.
Section 1. Understanding sciatica. Defining the pain.
So, sciatica isn't really a diagnosis all on its own. It's actually a very specific type of altered sensation. We're talking about pain radiating along the sciatic nerve, which starts in your lower back, goes through your buttocks, and travels all the way down your leg. According to the clinical literature, if you're feeling numbness, burning, or tingling, well, those are classic red flags of nerve irritation or entrapment. It's not just regular muscle soreness. Your nerve is literally trapped or pinched by something, like a herniated disc, arthritis, or really tight muscle.
To actually get some relief, the Orthopedic Associates of Hartford highlight a few foundational rules you absolutely have to follow alongside any physical therapy. First off, simply avoid positions that make the pain worse. You've got to maintain proper posture and use correct lifting techniques. But honestly, the biggest trap for most of us is that last one: avoiding prolonged sitting or standing. Think about it. You can't just do your exercises for 10 minutes and then hunch over a desk for 10 hours. Your daily lifestyle habits are just as crucial as the therapy itself.
Section 2. The science of nerve flossing. Nerves versus muscles.
Now, what's really interesting here is that nerves are not like muscles. If you pull a muscle to stretch it, the fibers lengthen. That's your basic everyday stretching. Nerves, on the other hand, absolutely hate being stretched. If you pull a nerve tight, it gets super agitated and inflamed. So instead of stretching, we use nerve gliding, or flossing. Picture your sciatic nerve as a piece of dental floss trapped inside a really tight tube. Flossing gently pulls that nerve back and forth through its surrounding sheath. This gentle movement reduces adhesions, frees the nerve from that trapped tunnel, and gets the blood flowing again to promote real healing.
Section 3. Nerve glide exercises. A step-by-step guide.
If you're a beginner, this is the perfect, gentle starting point: the seated sciatic nerve glide. Just like the Sciaticom guide outlines, you sit upright with your back nice and straight and extend one leg out. Now for the mechanics. You flex your foot by pulling your toes towards you. And, this is the key, at the exact same time, you tilt your head forward, bringing your chin to your chest. Hold it for just a second, then return to the start. By moving your head and foot simultaneously, you're gently gliding that nerve back and forth. You'll want to do this controlled movement about 10 times per leg.
Now, if you have a bit more balance and flexibility, you can graduate to the standing version of this. The mechanics are really similar, but the great thing is you can do this literally anywhere. Stand shoulder-width apart, extend one leg forward resting on your heel, and flex your toes up. Then bend forward slightly from the hips, keeping your back totally straight, and drop your chin to your chest. Hold for a few seconds, release, and repeat 10 times. It's honestly a fantastic midday mobility break if you're stuck at the office.
If you're dealing with severe pain, the lying or supine variation is exactly where you want to start, because being flat on your back fully supports your spine. You just lie back, grab behind your knee, and try to straighten your leg until you feel a very mild tension. Then, while holding the leg right there, simply bend your ankle forward and backward. That little ankle pumping motion, that's what actually glides the nerve through its sheath.
To make this incredibly actionable for you, here's the clinical prescription for that supine glide. You want to repeat that ankle pumping motion 10 times, holding the end position for about 3 seconds each time. Try to knock out 2 complete sets and aim for twice a day. It's the consistency of this exact pacing that actually teaches the nerve to slide freely again.
Section 4. Essential sciatica stretches. Releasing tightness.
So while we can't stretch the nerve, we definitely want to stretch the tight muscles around it.
First up, the kneaded chest variations for relieving lower back tension. You can do the single kneaded chest, gently pulling one knee up while lying flat. Or there's the double kneaded chest, bringing both knees up, which is absolutely fantastic for opening up the lower lumbar spine. These are your foundational stretches to decompress the exact area where the sciatic nerve originates.
The crucial point here is that you cannot rush these static holds. Unlike the dynamic flossing we were just doing, this is all about sustained muscle release. For the single knee, hold it for 20 seconds and repeat 3 times. For the double knee, hold for 10 seconds and repeat 5 times. Do a set of these twice a day. You really have to give those muscle fibers the time they need to actually relax and lengthen out.
Next, we're targeting the piriformis. This is a deep muscle in your buttocks, and when it tightens up, it loves to clamp right down on the sciatic nerve. You've got 2 great options here. There's the modified version, where you pull your knee across your body toward the opposite shoulder. Then there's the figure 4, where you cross your ankle over a bent knee and gently push the inside of the crossed leg. Both are amazing for opening up those deep hip and glute muscles.
Here are your exact targets for those piriformis releases. If you're doing the modified stretch, hold it for 20 seconds 3 times. For the figure 4, 15 seconds 3 times. Aim to do these as one set twice a day. Seriously, if you spend a lot of your days sitting, your piriformis is probably locked up tight, and these stretches are your golden ticket to relieving that physical pressure on the nerve.
Because the sciatic nerve runs straight down the back of your leg, tight hamstrings are a massive contributor to the pain. Grab a towel for this one. By lying down and hooking the towel under your foot, you can pull the leg upward while keeping the knee perfectly straight. This gives you a really deep, isolated stretch along the back of the leg, but without straining your lower back. Repeat this twice, holding for 30 full seconds, 2 times a day.
Rounding out our stretches, we have lower trunk rotations, or as they're delightfully called, wig-wags. Just lie on your back with your knees bent and gently let your knees fall to one side, then slowly reverse to the other side. You aren't holding this for a long time at all, just a quick 1-second pause at the end of a comfortable stretch. Doing about 20 reps once a day is a perfect way to introduce gentle rotational mobility back into your lumbar spine.
Section 5. Common mistakes to avoid. Protect your progress.
Let's see how all this builds a complete framework for recovery, because these guardrails are absolutely critical. First rule, never overstretch. If you push past the pain, you will just inflame the nerve more. Second, posture is everything. Keep your movements controlled and your back straight. Third, and I can't stress this enough, doing these once a week won't cut it. Inconsistent practice is the enemy here. You need a daily routine. And finally, for long-term success, you've got to combine these movements with bigger lifestyle changes like physical therapy, weight management, and ergonomic tweaks at work. Now, it is incredibly important that we pause for a quick medical disclaimer. While a little bit of mild soreness is totally normal when you start a new mobility routine, any persistent, worsening, or sharp pain means you need to stop immediately. Everything we've talked about is meant to empower you, but it absolutely does not replace a visit to a qualified doctor or physical therapist to get a personalized diagnosis.
Here is the big takeaway I want to leave you with today. Healing isn't just sitting around on the couch waiting for the pain to mysteriously vanish. It is about actively, intentionally teaching your nerves how to move and glide again within your body. You now have the exact blueprint to make that happen. So, are you ready to take control of your recovery today? Thank you so much for joining me on this explainer. Keep learning, keep moving, and we will see you next time.